There are a lot of different types of breast surgery, but I would loosely classify them into surgery for breast cancer. That's perhaps the most obvious reason for operating on the breast. And then surgery for non-cancerous conditions, and there's a whole range of non-cancerous conditions. Many women will have heard of breast mice, for example, or for bleeding from the nipple, these sorts of things. And also we operate on men, both for cancer and for non-cancerous reasons. And then the third category would be cosmetic, purely aesthetic surgery. That's an area where we're seeing actually increasing number of both women and men having surgery on their breasts. This is where you make a personal choice to change your appearance. And it's normally done by plastic surgeons and also breast surgeons like myself. And then the final category, increasingly, this is something that we're starting to see in the last decade, is gender surgery. So people who wish to identify as a different gender may have surgery on their breast or their chest wall to help reaffirm their gender identity. And so that's something that we're starting to see a little more of. And there are very specialist breast and plastic surgeons who offer that type of surgery. Yes, that's a very good question, because on the whole, Madalena, we try to avoid operating on the breast for obvious reasons, because surgery generally requires an anaesthetic and usually leaves a scar, both of which are fairly undesirable situations. But the most common reason for operating on the breast is for breast cancer. So I would say that the majority of surgery takes place for breast cancer, to remove a breast cancer. But as I've said, there are benign conditions, both in men and women, where you may have a lump and you just don't want that lump to be present. Or you may have bleeding from the nipple, which is caused by a little papilloma, that's a little warty growth inside the nipple. And people generally don't like to have bleeding from their nipples, so they might have that removed. And sometimes we see men develop a condition called gynecomastia, which is where they get swollen breasts. That's sometimes termed moobs, male boobs. And so sometimes they want a plastic surgeon to help them redefine their chest wall and their contour and get rid of that. So mainly for breast cancer, occasionally for non-cancerous conditions, and this increasing number of people having cosmetic surgery and gender affirming surgery. So the most common type of breast procedure is for breast cancer. And generally, that's going to be what's sometimes referred to as a lumpectomy. That is where you cut out the cancer. I think a lot of breast surgeons prefer the term wide excision, because lumpectomy suggests you just take out the lump. But cancer surgery is generally a lot more than that. You cut out the lump, but you also cut out a rim of healthy tissue so that you get out the little rootlets of the cancer. And that's called breast preserving or breast conserving surgery. And it's usually always followed by radiotherapy. And that's the most commonly performed operation. Women who've got breast cancer, about 60% of women who've got breast cancer have breast conserving or preserving surgery followed by radiotherapy. The other 40% have mastectomy. That's where you remove the whole breast. And of those women who require whole breast removal, approximately 1/3 of them will have a reconstruction at the time of having their breast removed. So the most commonly performed surgeries are breast conserving surgery, followed by mastectomy with or without breast reconstruction surgery. It's interesting to note, Madeleine, we don't actually know how many men and women have cosmetic breast surgery, because there's not very clear data on that. But we think that there's approximately 12 or 15,000 operations a year on men and women for cosmetic surgery, but approximately 100,000 operations a year for breast cancer, gender reaffirming surgery, or non-cancerous conditions. So you can see there's quite a difference in the two groups, but it's difficult for us to be very precise about how much cosmetic surgery takes place, because this generally takes place in the independent or private sector, whereas on the NHS we have a lot of data collection, so we know what we do on the NHS, but we're starting to collect data in the private and independent sector, but it's just not as comprehensive as it is in the NHS. Yes, that's a really good question, and it's probably the most commonly asked question that I get. Am I going to get pain? And of course, as a surgeon, I'm always going to say, no, you won't get pain. And nobody ever believes me. But actually, breast surgery is not particularly painful surgery, because it's all on the surface. You're not delving inside the body. You're not going into the thoracic chest cavity. You're not going inside the abdomen. And you're not cutting muscle or cutting bone, because that is painful to recover from, cutting muscle and bone. So this is all surface surgery. So generally, it's not particularly painful surgery. And that's why so much of breast surgery can be conducted as day case surgery, or just coming into hospital for one night, because you don't require lots of complicated pain-killing drugs such as morphine. Most women who have breast surgery might just require a very small dose of morphine or codeine, and then just simple painkillers like paracetamol and Nurofen. So generally fairly straightforward. As I say, most of my patients don't believe me when I say you won't get a lot of pain. And then when they come back to see me after the operation, they say, oh, you were right. And I say, yes. They say, I just took some paracetamol for 24 hours and I was fine. Now, clearly different operations, you know, if you're having your breast removed and you're having reconstructive surgery, you're going to need more pain relief. But even so, even after major surgery like removal of the breast and reconstruction, it's surprising how little pain relief is required. That's partly as well because we use a lot of local anaesthetic at the time of surgery. And there's lots of high quality evidence now to show that if you put local anaesthetic into the wounds at the end of surgery and women wake up comfortable, then they don't experience as much pain as women who've not had local anaesthetic. So we block all the local nerves with local anaesthetic, and we put local anaesthetic into the skin afterwards. And you know, no surgery can be carried out with zero pain, but it's very tolerable, the pain, surprisingly. Recovery, yes, you did ask me about recovery. Recovery is more difficult to predict because that depends on the amount of surgery and also on a patient's personality and any other underlying health problems, and also what they need from their recovery. So for the majority of women, if they have surgery done as a day case, the next day they'll be a little tired and they might want to rest for a couple of days after their surgery, but usually they can drive within 2 or 3 days of surgery and they might be able to get back to their work within a week or so. Now clearly that does depend on what work they do. But somebody who's had very major surgeries, such as the removal of their breast and a reconstruction, they may need to take 3 months off work. and they may not be driving for 6 or 8 weeks. So I often say to somebody, if you're a professional tennis player, you're probably not going to get back to professional tennis playing for a year. But if you can conduct a lot of your life online, for example, if a lot of your work is done online, then you might be able to get back to that in a few days' time. So it's very variable, but it's an important question because it's the most commonly asked question that I get. And it is very personality dependent as well, because there's no doubt that some people do seem to suffer more from side effects of surgery than other people, and that can be a little difficult to predict. But we've got very good now at managing pain, and we've got very good at anticipating who might require a little more support than somebody else. Well, I normally recommend resting for a couple of days. And by resting, I don't mean staying in bed. I mean just taking it easy at home. So you get up, you potter around the house, you can do whatever you want to do. You can make yourself a coffee, you can make yourself food, but just resting, perhaps having a sleep in the afternoon and going to bed early so that you get plenty of sleep. Because when you've had surgery, you need a lot of sleep to let your body recover. And so just allow yourself to relax. Most of us lead such busy lives that if we sit down for a moment, we feel guilty. And you shouldn't feel guilty. Just sit down, relax, and take it easy. But you want to get the balance right, because one of the risks of surgery is deep vein thrombosis. And deep vein thrombosis happens if you sit for too long. So you've got to get that balance right between activity and resting. And what should you avoid doing? Vigorous exercise. You should avoid vigorous exercise, because when you're recovering from the anaesthetic and surgery, vigorous exercise might give you more pain. It might cause bleeding. It might cause bruising. So I normally recommend that you avoid vigorous exercise. So don't go to the gym, don't go jogging. And avoid all of that, perhaps for a couple of weeks. But your surgeon can give you specific individual advice depending on the nature of your surgery. One of the questions I get asked very commonly from women is, should I wear a bra or not after surgery? And do I need to be specially fitted? And bra is a very personal thing, because bras are not medical devices, they're an item of clothing. And some women, particularly heavy-breasted women, feel much more comfortable wearing a bra, and other women with smaller breasts actually find bras very constrictive and uncomfortable. And so I think it's a personal decision for a woman to make. But if a woman's had major surgery, sometimes wearing a soft bra, particularly in bed at night, can be helpful when she moves around in the bed at night, because it supports the breast and that helps with pain. But it is a personal decision. I do normally advise that don't go out and spend lots of money on expensive post-surgery bras. Some women do find that helpful, but some of these post-surgery bras are incredibly expensive and you're only going to be wearing them for a few weeks. And sometimes some of the nursing bras that you can buy from Sainsbury's, from Asda, from Marks and Spencer's, they're relatively good value and you can throw them away at the end. And it's the same applies for sports bras, particularly the ones that zip up or do up at the front, because it's quite difficult to do a bra up at the back when you've had surgery. So normally trying to get something that you can do up at the front is often much easier. But there are plenty of specialist websites if women want more specific advice. And also, a lot of women have access to their breast care nurses in their hospital. And also there are many breast charities such as Breast Cancer Now who will give advice online to women particularly.